Okay, let's see. Cerebrovascular accidents, CVAs, or strokes. A stroke, also known as a cerebrovascular accident or CVA, occurs when the blood supply to a part of the brain is suddenly interrupted, and thus brain cells are deprived of oxygen. Some cells die, others are left badly damaged. With timely treatment, the damaged cells can be saved. There are two types of stroke. Ischemic stroke account for 90% of all strokes and are caused by atherosclerosis, plaque in the wall of the cerebral artery, embolism, embolism, blood clot in the cerebral artery originating from elsewhere in the body, and microangiopathy. Occlusion of small cerebral arteries. Hemorrhagic strokes, also known as intracerebral hemorrhage, occur when a blood vessel in the brain bursts or when a cerebral aneurysm or arteriovenous malformation AVM ruptures. So stroke, plaque and disease, carotid artery, blood clot, thrombus breaks off, blood clot in cerebral artery blocks blood flow. So atherosclerosis in cerebral artery, leaving a small residual lumen. And it leaves your blood-starved tissue on the right, turns gray. Oh shit. Ay. Okay. Symptoms of stroke. The symptoms of a stroke can include the sudden onset of numbness or weakness, especially on one side of the body, difficulty in walking, balance, or coordination, trouble speaking or understanding speech, trouble seeing in one or both eyes, dizziness, confusion, and severe headache. A method to remember common warning signs of stroke is to use the acronym FAST. F for face. Ask the person to smile. Does one side of the face droop? Arms. Ask the person to raise both arms. Does one arm drift downward? Speech. Ask the person to repeat a simple phrase. Is his or her speech slurred or strange? And time. If any of the previous signs is present, time to call 911 immediately. Disability after strokes. Although stroke is the disease of the brain, it can affect the whole body. A common residual disability is complete paralysis of one side of the body, called hemiplegia. If one side of the body is weak rather than paralyzed, the disability is called hemiparesis. Problems with forming and understanding speech and problems with awareness, attention, learning, judgment, and memory can remain after a stroke. Stroke patients may have difficulty controlling their emotions and may experience depression. All of these disabilities require well-planned rehabilitation. Transient ischemic attack. Transient ischemic attacks, TIAs, are short-term small strokes with symptoms lasting for less than 24 hours. If neurologic symptoms persist for more than 24 hours, then it is a full-blown stroke with brain cell damage and death. The most frequent cause of a small embolus that occludes a small artery in the brain. Often the embolus arises from a clot in the atrium, in atrial fibrillation, or from an atherosclerotic plaque in a carotid artery. If the impairment of blood supply lasts more than a few minutes, the affected nerve cells can die and cause permanent neurologic deficit. Risk factors for ischemic strokes are hypertension, diabetes mellitus, high cholesterol levels, cigarettes, and obesity. Risk factors for hemorrhagic strokes are hypertension, cerebral arteriovenous malformations, and cerebral aneurysms. More than 10% of people who have a TIA will have a stroke within 3 months. So aneurysm is Greek for dilation, meaning circumscribed dilation of an artery or a cardiac chamber. Aneurysmal is the adjective for aneurysm. Arteriovenous malformation, okay, an abnormal communication between an artery and a vein. Cerebrovascular accident, also known as a stroke. Cerebral brain vascular blood vessel are pertaining to an acute clinical event caused by an impaired cerebral circulation. Embolus, Greek for plug, stop, detached piece of thrombus, a mass of bacteria, quantity of air, or a foreign body that blocks a blood vessel. Hemiparesis, hemi is in half, paresis weakness. Weakness of one side of the body. Hemiplegia, plague or pleage, meaning paralysis. E is a condition, hemi half. Paralysis of one side of the body. Hemiplegic is the adjective for hemiplegia, pertaining to or suffering from hemiplegia. Ischemia, isch is to keep back. Emia is blood condition. It's a lack of blood supply to a tissue. Ischemic is an adjective for ischemia, meaning pertaining to or effective ischemia. Microangiopathy, micro small anglo blood vessel-pathy disease, disease of the very small blood vessels, capillaries. So cerebral palsy definition. Cerebral palsy, CP, is a term used to describe the motor impairment resulting from brain damage in an infant or young child. Regardless of the cause or the effect on the child, it is not hereditary. In congenital CP, the cause is often unknown, but can be brain malformations or maternal use of cocaine. Cerebral palsy developed at birth or in the neonatal period is usually related to an incident causing hypoxia of the brain. Cerebral palsy causes delay in the development of normal milestones in infancy and childhood. The medical terminology of classification and effects of CP is important, and it is used in many other conditions, including the after effects of strokes. The technical terms that follow are labels used to describe the type and extent of problem. They do not describe the individual. Classifications of limbs impaired. Quadriplegia or tetraplegia, all 4 limbs are involved. Diplasia, paralysis of corresponding parts, example both arms or both sides of the body. Hemiplasia, the arm and leg of one side of the body are affected. Monoplasia, only one limb is affected, usually an arm. Paraplasia, both lower extremities are involved. And triplasia, the limbs are 3 limbs are involved. Classification by movement disorder. Spastic, pertaining to tight muscles that are resistant to being stretched. They can become overactive when used and produce clonic movements. Athetoid, pertaining to difficulty in controlling and coordinating movements, leading to involuntary writhing movements and constant motion. Ataxic, pertaining to poor sense of balance and depth perception, leading to a staggering walk and unsteady hands. CP is caused by damage to the developing brain. Of all CP cases, 75% occur during pregnancy, 5% during childbirth, and 15% during infancy up to age 3. Spastic CP is the most common type, occurring in 70% to 80% of all cases. Spastic CP can occur as spastic hemiplegia, spastic diplasia, and spastic quadriplegia. Babies with very low birth weights are more likely to have CP. The classifications of movement disorders and numbers of limbs involved are combined, for example, spastic dysplasia. So ataxia, tax is coordination, A without, E a condition, inability to coordinate muscle activity leading to jerky movements. Ataxic, pertaining to the suffering from ataxia. Athetosis, a slow writhing involuntary movement. Athetoid, adjective for athetosis. Athet meaning uncontrolled without position, and oid meaning resembling athetosis. Clonic, Greek for turmoil, alternating muscular contraction and relaxation. Diplegia, plege, paralysis, condition. Paralysis of corresponding parts on both sides of the body, example, both arms. Diplegic, pertaining to or suffering from diplegia. Impairment, meant action, state, impair, worsen, diminishing of normal function. Monoplasia, paralysis of one limb. Monoplegic, pertaining to or suffering from monoplasia. Palsy, Latin for paralysis or paresis from brain damage. Paraplegia, the paralysis of both lower extremities. Paraplegic, adjective for paraplegia, pertaining to or suffering from paraplegia. Quadriplegia, paralysis of all four limbs. Quadriplegic.
Quadriplegic? What? Sorry.
Pertaining to or suffering from quadriplegia.
Thank you.
Spasm, Greek for spasm, sudden involuntary contraction of a muscle group, increased muscle tone on movement. Spastic, adjective for spasm, spast meaning tight, pertaining to or suffering from increased muscle tone or movement. Tetraplegia, paralysis of four limbs. Tetraplegic, pertaining to or suffering from tetraplegia. Triplegia, paralysis of three limbs. Triplegic, adjective for triplegia, pertaining to or suffering from triplegia. Epilepsy. Epilepsy is a chronic disorder in which clusters of neurons in the brain discharge their electrical signals in an abnormal rhythm. This disturbed electrical activity, a seizure, can cause strange sensations and behavior, convulsions, and loss of consciousness. Between 1 and 3% of the population will develop some form of epilepsy. 2/3 of epileptic patients are manageable with medication. Status epilepticus is a medical emergency. First aid treatment of a seizure is to ease the person to the floor and turn them on their side. Do not try to keep the limbs from moving. The causes of epilepsy are numerous, from abnormal brain development to brain damage. In 2017, the International League Against Epilepsy revised its classifications based on the onset of the seizure. Number 1, focal seizures, previously termed partial seizures, occur when the epileptic activity is in one area of the brain only. For example, in a partial seizure, the only symptom of an epileptic attack could be a series of involuntary jerking movements of a single limb. Generalized onset seizures occur in both hemispheres of the brain. Examples include absence seizures, previously known as petit mal, are most common in children ages 4 to 14 but may continue through adult life. The child stares vacantly for less than 10 seconds, apparently out of contact with surroundings. The child may be accused of daydreaming. Recovery is quick. Tonic-clonic seizures, previously called grand mal, are dramatic. The person experiences a loss of consciousness, LOC. Breathing stops, the muscles stiffen, and the jaw clenches. This tonic phase lasts for 30 to 60 seconds. It is followed by the clonic phase, in which the whole body shakes with a series of violent rhythmic jerkings of limbs. The seizures last for about 1 to 3 minutes, and consciousness returns. Febrile seizures are triggered by a high fever in infants ages 6 months to 5 years. Very few of these infants go on to develop epilepsy. And unknown onset seizures are those that the practitioner is unsure of its onset. It serves as a temporary classification until a practitioner is able to determine its onset type. Status epilepticus occurs when the brain is in the state of persistent seizure. It is defined as one continuous seizure lasting more than 10 minutes, or 3 recurrent seizures without the person regaining consciousness between them. Many physicians believe that 5 minutes in this state is sufficient to damage neurons. Status epilepticus is a medical emergency and requires maintenance of the airway, breathing, and circulation, and the intravenous IV administration of diazepam and anticonvulsant drugs. Seizures may be followed by a postical state period of diminished function in the area of the brain surrounding the seizure focus. Symptoms include confusion, muscle soreness, and headache. Syncope and cataplexy are symptoms of other conditions that resemble symptoms of epilepsy. Syncope, fainting or passing out, is a temporary loss of consciousness and posture. It is usually due to hypotension and the associated deficient oxygen supply, hypoxia, to the brain. This disorder is called neurally mediated syncope in MS. In adults, it may be associated with cardiac arrhythmias and other diseases. Cataplexy, the sudden loss of voluntary muscle tone with brief episodes of total paralysis associated with narcolepsy. Sleep paralysis, excessive daytime sleepiness, and hallucinations are also symptoms of narcolepsy. Absent seizure, ab away from sense to feel, your process, siege to convulse. A brief seizure characterized by absence of activity and occasionally clonic movements. Epilepsy, Greek for seizure, chronic brain disorder due to paroxysmal excessive neural discharges. Febrile, Latin for febris, pertaining to or having a fever. Postical, occurring after a seizure. So ict is seizure. Status epilepticus. Stat is standing still. A recurrent state of seizure activity lasting longer than a specific time frame, usually 30 minutes. Tic, French for tic, sudden involuntary repeated contraction of muscles. Tonic-clonic seizure, a generalized seizure due to epileptic activity in all or most of the brain. Tonic, muscular contraction in a continuous state relating to muscle movements showing contraction and relaxation in rapid succession. Clonic, and seizure and epileptic attack. Other brain disorders. Movement disorder. Parkinson's disease is caused by the degeneration of neurons in the basic ganglia that produce a neurotransmitter called dopamine. Motor symptoms of abnormal movement, tremor of the hands, rigidity, a shuffling or hastening, falling forward gait, and weak voice appear. The symptoms gradually increase in severity. The cause is unknown, and there is no cure. A common tic disorder is provisional tic disorder, occurring in 20% of children during the early school years. Huntington disease, also known as Huntington chorea, is a hereditary disorder starting with mild personality changes between the ages of 30 and 50. Involuntary, irregular, jerky, choreic movements and muscle weakness follow, and dementia occurs in later stages. A gene defect is on chromosome 4, but there is no known cure. Tourette syndrome, TS, and other tic disorders are characterized by episodes of involuntary, rapid, repetitive, fixed movements of individual muscle groups. They occur with varying frequency and are associated with meaningless vocal sounds or meaningful words and phrases. Neoplasm. Brain tumors are most often secondary tumors that have metastasized from cancers in the lung, breast, skin, or kidney. Primary brain tumors arise from any of the glial cells that are called gliomas. The most malignant form of glioma is called glioblastoma multiforme. Headaches. A headache or cephalalgia. Cephalalgia. How do you say this?
Cephalalgia or cephalalgia.
A headache, cephalalgia, is classified into either being primary or secondary. Secondary headaches occur for the first time in relation to another disorder. Primary headaches include migraine, produces an intense throbbing, pulsating pain, usually in one area of the head, often with nausea and vomiting. It can be preceded by an aura, visual disturbances such as flashing lights or temporary loss of vision. It occurs 3 times as often in women as in men. tension type was previously known as tension headache, ordinary headache, and muscle contraction headache. The exact cause of this type of headache is unknown. Patient will report increased tenderness with palpation of head and neck muscles. Trigeminal autonomic cephalalgia consists of cluster headaches, among other headache types, with intense unilateral pain in the suborbital or supraorbital, orbital, and or temporal regions. Attacks occur in series that may last for weeks or months, cluster periods. Other primary headache disorders are those that do not fit the previous categories and occur without a secondary cause. Examples of this category of headaches include headaches due to cough, exercise, or cold stimulus. Aura, Greek for breath of air, sensory experience preceding an epileptic seizure or a migraine headache. Bovine spongiform encephalopathy. Disease of cattle, mad cow disease that can be transmitted to humans, causing Creutzfeldt-Jakob disease, also known as mad cow disease. Cephal for head, sponge, form appearance of pathy disease pertaining to cataplexy, sudden loss of muscle tone with brief paralysis. Cephalology.
The enchiladas are on for 20 minutes. I'll be back in 20 minutes.
Cephalalgia.
Cephalalgia,
Love you.
pertaining to
Cephalalgia.
pain in the head. Chorea, Greek for dance. Involuntary irregular spasms of limb and facial muscles.
Choreic.
Choreic is an adjective for chorea. Creutzfeldt-Jakob disease. Hans Creutzfeldt, 1885 to 1964, and Alphonse Jacob, 1884 to 1931, neuropsychiatrist. Progressive incurable neurologic disease caused by infectious prions. Festinant, Latin to hasten. Shuffling and falling forward gait. Glioblastoma multiforme, a malignant form of brain cancer. Glioma is the tumor arising in a glial cell. Huntington disease, progressive, inherited, degenerative, incurable neurologic disease, named after George Huntington, U.S. physician. Huntington chorea is a synonym for Huntington disease. Chorea means Greek for dance. Then we have migraine. Paroxysmal severe headache confined to one side of the head. My derived from hemi or have, and grain means head pain. Narcolepsy. Narco is stupor, lepsy seizure. Condition with frequent incidents of sudden involuntary deep sleep. Parenchyma or parenchyma.
Parenchyma.
Parenchyma, Greek to pour in beside. Characteristic functional cells of a gland or organ that are supported by the connective tissue framework. Parkinson's disease, named after James Parkinson, a British physician born 1755 and passed 1824. Disease of muscular rigidity, tremors, and mask-like facial expression. Prion, derived from protein infectious particle, small infectious protein particle. Ray syndrome, named after R. Douglas Ray, born 1912, passed 1977, Australian pathologist. Encephalopathy and liver damage in children following an acute viral illness linked to aspirin use. Syncope, Greek for cutting short, temporary loss of consciousness and postural tone due to diminished cerebral blood flow. Tourette syndrome, named after Georges Gilles de la Tourette, French neurologist, born 1857, passed 1904. Disorder of multiple motor and vocal tics, and tremor, Latin to shake, small shaking, involuntary repetitive movement of hands, extremities, neck, or jaw. Infections of the brain, brain abscess. Oh, where did I put it? My drink. Is most often a direct spread of infection from sinusitis, otitis media, or mastitis. It also can be a result of bloodborne pathogens from lung or dental infections, brain abscess. Creutzfeldt-Jakob disease, CJD, produces a rapid deterioration of mental function with difficulty in coordination of muscle movement. Some cases are linked to the consumption of beef from cattle with mad cow disease, bovine spongiform encephalopathy, or BSE. Damage to the brain is thought to be caused by an abnormal infectious protein called prion. Encephalitis is inflammation of the parenchyma of the brain. It is usually caused by a virus such as human immunodeficiency virus, HIV, West Nile virus, herpes simplex, or the childhood disease of measles, mumps, chickenpox, and rubella. It occurs most often in the elderly, those with compromised immune systems, and children. Thank you, Pat. Traumatic brain injury. Traumatic brain injury, TBI, are events that cause damage to the brain. A bump, blow, or jolt to the head and penetrating head injury can cause a TBI. Over 1 million people are seen by medical doctors each year following a blow to the head. Of these, 50,000 to 100,000 will have prolonged problems affecting their work, and their activities of daily living, ADLs. These injuries can occur during combat situations, but they also occur in sports such as boxing, ice hockey, and football, which are all sports that often involve severe contact injuries to the head. About 5.3 million Americans, 2% of the population, are living with disabilities from TBI. Post-traumatic stress disorder, PTSD, occurs after a TBI when stress symptoms impair the person's ability to function. If you're driving your car at 50 miles per hour and you're hit head-on, your brain goes from 50 miles per hour to zero instantly. Your soft brain tissue is propelled forward and squished against the front of your head of your hard skull, your coop. Then the brain and the rest of your body rebound backward. The soft brain is then squished against the back of your rigid skull, your contra coop. The squished front and back areas are at least bruised. This bruise is called a contusion. If the process is more severe, blood vessels tear and blood flows into the brain. In addition, the brain itself can tear and cut brain connections and signals. In an injury, brain swelling can occur. Because the skull is hard and rigid, it cannot expand to cope with this extra volume, so the soft brain tissue is compressed and some areas can stop working. A mild head injury is called a concussion. You may feel dazed or have a period of confusion during which you do not recall the event that caused the concussion. In more severe cases, you may lose consciousness for a brief period of time and have no memory of the event. Repeated concussions can have a cumulative effect with loss of mental ability, as in many American football players, and traumatically induced Parkinson's disease, as happened with professional boxer Muhammad Ali. In more severe TBIs, the symptoms will depend on the area of the brain damage. Some symptoms, such as difficulty with memory or concentration, irritability, aggression, insomnia, post-traumatic stress disorder, or depression, can be long-term. Traumatic brain injury has become a signature wound of the wars in Iraq and Afghanistan. Shaken baby syndrome, SBS, also referred to as abusive head trauma. AHT is a type of TBI produced when a baby is violently shaken. The baby has weak neck muscles and a heavy head. Shaking makes the brain bounce back and forth in the skull, leading to severe brain damage. Other injuries include retinal hemorrhages, subdermal hematoma, damage to the spinal cord, and fractures of the ribs and limb bones. This syndrome usually occurs in children younger than 2 years old. Commonalities of brain injury. Cerebral edema is excess accumulation of water in the intra or extracellular spaces of the brain. It is associated with trauma, tumors, inflammation, toxins such as aspirin and Rey syndrome, ischemia, and malignant hypertension. Oh my gosh, you're so cute. Hi. Did you get some good food? Yeah. The residual effects of brain damage, whether due to trauma or stroke, have terminology. So impairment is a deviation from normal function, for example, not being able to control an unwanted muscle movement. Disability is a restriction in the ability to perform a normal activity or daily living, ADL. For example, a 3-year-old who cannot walk independently. Handicap is defined as having a disadvantage that prevents a child or adult from achieving a normal role in society commensurate with age and social cultural setting or socio-cultural setting. For example, a 16-year-old who cannot take care of personal toiletry and hygienic needs. Activities of daily living, daily routines for mobility and personal care, bathing, dressing, eating, and moving. Concussion is a mild head injury. Concusses to shake violently. Contusion is the bruising of a tissue including the brain. Contus is bruise. Coup is French for a blow. Injury to the brain occurring directly under the skull at the point of impact. Contre-coup is French for a counterblow. Injury to the brain at a point directly opposite of the point of the original contact. Disability is disaway, ability, competence, so away from competence. Diminished capacity to perform certain activities or functions. Edema, Greek for swelling, excessive collection of fluid in cells and tissues. Handicap, condition that interferes with the person's ability to function normally. Insomnia is inability to sleep, and Rey syndrome, named after R. Douglas Rey, 1912, past 1977, Australian pathologist. Encephalopathy and liver damage in children following an acute viral illness linked to aspirin use. Disorders of the meninges. Intracranial hemorrhages are often the result of head trauma. Hematomas form as blood fills a space. Subdural hematoma is bleeding into the subdural space outside the brain. Most subdural hematomas are associated with closed head injuries and bleeding from broken veins caused by violent rotational movement of the head. They've been seen following roller coaster rides with high-speed turns that jerk and whip the head. Although the blood accumulation is slow, the bleeding must be stopped surgically. So intracerebral hematoma, a subarachnoid hematoma, intracranial hemorrhage. Okay, epidural hematoma, and a subdural hematoma. Okay. Epidural hematoma is a pooling of blood in the epidural space outside the brain. Most are associated with a fractured skull and bleeding from an artery that lies in the meninges. If the bleeding is not stopped surgically by ligating or tying off the blood vessel, brain compression with severe neurologic injury or death can occur. Spontaneous subarachnoid hemorrhage can be preceded by a sudden thunderclap, severe headache followed by nausea and vomiting. Oh, you want your treat? Want your treat? Kind of? Here, I'll put it there. You want it? It's right there. Okay. thunderclap, severe headache followed by nausea and vomiting. The blood collects between the pia mater and the arachnoid mater. It is commonly caused by the bursting of a blood vessel at the surface of the brain. Meningitis is inflammation of the meninges covering the brain and spinal cord. Viral meningitis is the most common form and occurs at all ages. Bacterial meningitis is more common in the very young or very old. Meningococcal meningitis is contagious, spread through droplet infection by coughing and sneezing and through close living conditions, as in college dormitories. Vaccines are available to prevent most causes of meningitis. Meningioma is a tumor. Meningioma is a tumor originating in the arachnoid cells of the meninges, most commonly overlying the cerebral hemispheres. It is usually benign and produces a slow-growing focal spherical tumor. Symptoms can take years to develop. Surgical resection is usually curative. Disorders of the cranial nerve. Bell's palsy is a disorder of the 7th cranial nerve, facial nerve, caused a sudden onset of weakness or paralysis of facial muscles on one or both sides of the face. Common symptoms are hemifacial, inability to smile, whistle, or grimace, drooping of the mouth with drooling of saliva, and inability to close the eye on the affected side. Early treatment with steroids or supportive measures is essential. The facial nerve can also be affected by trauma or tumors. Okay. Tic douloureux or trigeminal neuralgia is intermittent shooting pain in the area of the face and head innervated by the 5th cranial nerve. The pain is abrupt, sudden, unilateral, and often severe, and can affect any area of the face from the crown of the head to the jaw. Chewing or touching the affected area causes pain. Horner syndrome presents with unilateral droopy eyelid stosis, small pupil, and decrease in perspiration of the face. It can occur in lung cancer and injuries to the head, neck, and cervical spinal cord. The signs of Horner syndrome are due to the blocking of the sympathetic pathway to the eye. Okay, disorders of the meninges and cranial nerves. So Bell's palsy, named after Charles Bell, lived 1774 to 1842, Scottish surgeon, anatomist, and physiologist. Palsy, Latin for paralysis. Paresis or paralysis of one side of the face. Epidural, epis above, dura mater, and al pertaining to, above the dura. Hematoma, hematous blood, oma, tumor mass, collection of blood that has escaped from the blood vessels into tissue. Hemophagia, pertaining to one side of the face. Horner syndrome, disorder of the sympathetic nerves to the face and eye, named after Johann Friedrich Horner, lived 1831 to 1886, Swiss ophthalmologist. So a combination of symptoms and signs associated with particular disease. Meningioma, tumor arising from the arachnoid layer of the meninges. Meningococcal, pertaining to the meningococcus bacterium. COCC is a spherical bacterium. Meningitis is inflammation of the membrane surrounding the brain or spinal cord. Neuralgia is pain in the distribution of a nerve. Subdural is under dura mater, located in the space between the dura mater and arachnoid membrane. And tic douloureux,
Tic douloureux or tic douloureux.
Tic douloureux, Painful, sudden, spasmodic, involuntary contractions of the facial muscle supplied by the trigeminal nerve.